Good evening. If you're over 65, or watching this for someone you love, I want to share something that far too many of my patients discover only after years of unnecessary discomfort and restless nights. The way you sleep every single night can quietly worsen pain, breathing difficulties, and even long-term health risks that no one should have to face. I'm Dr. Choi Smith, a physician who has spent more than 25 years helping older adults across the United States restore comfortable, restorative sleep and reclaim their energy and independence. Tonight, I'll gently guide you through the 4 sleep positions research shows are least supportive for seniors, and the 4 far better ones you can begin trying as soon as tonight. Stay with me for the next 35 minutes. These simple changes can truly help you wake up with less stiffness, better breathing, and more strength for the day ahead. If this already resonates with you, please consider giving this video a like and subscribing with the bell turned on. It helps me reach more people who need this information, and ensures you'll receive future guidance that can protect your health for years to come. And feel free to share in the comments below which city or state you're watching from. It's always a great pleasure to hear from people all across the United States and beyond. Thank you for being here. Let's begin. Thank you again for staying with me. I truly appreciate the trust you're placing in this conversation. For those who don't know me yet, I'm Dr. Choi Smith. Over the past 25 years, I've had the privilege of caring for thousands of older adults in clinics and hospitals across the United States. My focus has always been on helping people in their 60s, 70s, 80s, and beyond maintain their independence, comfort, and vitality for as long as possible. One of the most common complaints I hear, day after day, is about poor sleep and waking up feeling worse than when they went to bed, stiff necks, aching lower backs, sore hips, numbness in arms, or simply feeling exhausted despite spending 8 hours in bed. What many patients are surprised to learn is how much the position they sleep in contributes to these problems. It's not just the mattress or the pillow, although those matter, it's the way the body is aligned for 6, 7, or 8 hours every single night. Over time, poor alignment places repeated stress on joints, muscles, ligaments, and even the way we breathe and circulate blood. As we age, several natural changes make sleep position even more important. Our spinal discs lose some of their cushioning, joints develop arthritis, muscles lose some strength, and tissues become less forgiving. Circulation can slow slightly, and conditions like sleep apnea or acid reflux become more common. All of these can be quietly worsened, or quietly improved, by how we position ourselves during sleep. Research from leading institutions such as the Mayo Clinic, Johns Hopkins, and the National Institutes of Health consistently shows that improper sleep posture is a major contributor to morning pain and stiffness in older adults. One large study published in the Journal of Gerontology found that more than 60% of adults over 65 who reported chronic neck or back pain slept regularly in positions that placed unnecessary strain on the spine. Another study from the American Academy of Sleep Medicine revealed that certain positions significantly increase the frequency of breathing pauses in people with mild to moderate sleep apnea, a condition that affects nearly half of older adults and raises risks for heart health and daytime fatigue. I've seen this firsthand. Patients come to me after months or years of gradually worsening symptoms, often having tried new mattresses, pain medications, or physical therapy, yet still waking up uncomfortable. When we gently adjust their sleep position and add simple supports like the right pillow placement, many notice improvement within just a few nights. They tell me they feel lighter in the morning, move more easily, and have more energy for the activities they love, gardening, walking with grandchildren, or simply enjoying a full day without needing an afternoon nap. The beautiful part is that these changes are free, require no medication, and can be started tonight. You don't need special equipment beyond perhaps an extra pillow or 2 that you likely already have at home. Over the next sections of this video, I'll walk you through, step by step and with clear demonstrations, the 4 sleep positions that research and clinical experience show are generally the least supportive for older bodies. I'll explain exactly why they create problems and what symptoms they can worsen. Then, most importantly, I'll show you the 4 much better alternatives that promote neutral spine alignment, easier breathing, and reduced pressure on joints. My goal is simple: to help you wake up feeling rested and ready for your day, not battling pain or stiffness that holds you back. Before we move into the first of the positions to avoid, I want to encourage you again, if you're finding this helpful already, please take a quick moment to like this video and subscribe with notifications turned on. It truly helps this message reach more people who are searching for relief, and it ensures you won't miss future practical guidance on sleep, mobility, and healthy aging. Now, let's begin with the sleep position that many experts consider the most challenging for older adults: sleeping on your stomach. We'll look at why it places such strain on the neck and lower back, and why it becomes increasingly difficult for the body to tolerate as we age. Now that we understand how important sleep position is for older adults, let's begin with the one that sleep specialists and orthopedic experts across the United States most consistently recommend avoiding: sleeping on your stomach, also known as prone sleeping. This position is surprisingly common. Many people have slept this way for decades and feel it's the only way they can fall asleep comfortably. But as we age into our 60s, 70s, and beyond, stomach sleeping becomes one of the most problematic positions for the body. Here's why. First, the neck. When you sleep on your stomach, you have to turn your head sharply to one side or the other to breathe. This twists the cervical spine, the neck, to nearly 90 degrees for 6 to 8 hours every night. That kind of sustained rotation puts significant strain on the small joints, discs, and ligaments in the neck. Over time, it can accelerate wear and tear, worsen existing arthritis, and contribute to chronic neck pain, stiffness, headaches, and even pinched nerves that radiate into the shoulders and arms. Studies from the American Academy of Orthopedic Surgeons and research published in the Journal of Physical Therapy Science have shown that prone sleeping increases cervical spine stress by up to 50% compared to side or back sleeping. For older adults, whose discs are already thinner and less hydrated, this repeated stress can lead to faster degeneration and more frequent flare-ups of discomfort. Second, the lower back. When you lie face down, the natural curve of your lumbar spine, the lower back, is flattened or even pushed into an exaggerated arch. This reverses the normal lordotic curve that protects the spine. The result is increased pressure on the lumbar discs and facet joints, which can aggravate sciatica, spinal stenosis, or general lower back pain. Many patients tell me they wake up with a stiff or achy lower back that takes hours to loosen up, and stomach sleeping is often the culprit. Third, breathing and circulation. Stomach sleeping can make it harder to breathe deeply because the mattress presses against the chest and abdomen. For people with even mild sleep apnea, which affects nearly half of adults over 65, this position makes breathing pauses more frequent and severe. Reduced oxygen during sleep adds to daytime fatigue, brain fog, and long-term risks for heart health and cognitive function. I've had countless patients in my practice who didn't realize their chronic neck and back pain was linked to this one habit. One woman in her late 70s came to me after years of physical therapy and pain medication. When we switched her to a supportive side sleeping position, her morning stiffness improved dramatically within 2 weeks. She said it felt like she had discovered a new body. The good news is that most people can break the stomach sleeping habit with patience and a few simple strategies. If you're used to it, start by placing a thin pillow under your pelvis to reduce the arch in your lower back. This makes the position slightly less harmful while you transition. Over time, gently encourage side sleeping by using a body pillow for support. But the best long-term solution is to move away from stomach sleeping entirely and adopt one of the safer positions we'll discuss later. Before we move on to the next position to avoid, I want to remind you, if this is already helping you understand your own sleep better, please consider liking this video and subscribing with the bell on. It really helps spread this practical information to more seniors who could benefit, and it ensures you'll get notified about future videos on sleep, pain relief, and healthy aging. Now, let's look at the second position that many older adults use regularly but that can create unnecessary strain: the very tightly curled fetal position. We'll explore why this common habit can compress breathing, stiffen joints, and contribute to morning discomfort, and what signs to watch for if it's affecting you. Let's now turn to the second position that can create challenges for many older adults: the very tight or closed fetal position. Many people naturally curl up like this when they sleep, knees pulled high toward the chest, arms hugged close, back rounded into a pronounced C shape. It can feel cozy and protective, especially on colder nights or when we're feeling a little anxious. However, when this curl becomes extreme and sustained for hours, it can place unnecessary stress on several parts of the body that become more vulnerable as we age. First, breathing. A tight fetal position significantly reduces the space for your diaphragm and lungs to expand fully. The rounded back and compressed chest limit deep, diaphragmatic breathing, making it harder for oxygen to reach your bloodstream efficiently. For older adults who may already have mild sleep apnea, reduced lung capacity, or conditions like COPD, this can lead to more frequent breathing pauses, lower oxygen levels overnight, and that heavy, unrefreshed feeling in the morning. Research from the American Thoracic Society has shown that highly flexed postures during sleep can decrease lung volume by up to 20%, enough to noticeably affect sleep quality and daytime energy. Second, the spine and hips. The extreme rounding of the back flattens the natural curves of the spine and places prolonged pressure on the lumbar discs and sacroiliac joints. Over time, this can contribute to lower back stiffness, hip tightness, and even aggravate arthritis in the hips or knees. Many patients tell me they wake up feeling locked up in the hips or lower back, needing several minutes to straighten fully, and the tight fetal position is often a key factor. Third, neck and shoulders. When the chin is tucked sharply downward in this curled posture, the neck flexes forward for hours, straining the cervical spine and tightening the muscles at the base of the skull. This can lead to morning headaches, neck soreness, or tension that radiates into the shoulders. I remember a gentleman in his early 70s who had slept in a very tight fetal position his entire life. He came to me complaining of chronic morning stiffness and shortness of breath upon waking. Once we gently encouraged a more open side sleeping posture with proper pillow support, his breathing improved noticeably, and his morning mobility returned within days. The encouraging news is that you don't have to abandon side sleeping entirely. In fact, side sleeping is one of the best options when done correctly. The key is to avoid the extreme curl and instead adopt a more relaxed alignment, which we'll cover in detail later. If you recognize yourself in this description, know that small adjustments can bring meaningful relief. As we continue, we'll move to the third position many seniors use regularly, sleeping flat on the back without adequate support. We'll explore why this seemingly neutral position can actually worsen certain common age-related issues, and how simple pillow placement can make all the difference. We now come to the third position that can quietly cause problems for many older adults, sleeping on your back completely flat, without any supportive pillows under the head or knees. At first glance, back sleeping seems neutral and even recommended by some experts. It can be a good choice when done correctly, but lying perfectly flat, especially on a firm mattress, often creates two significant issues as we age. The first issue is in the lower back. When you lie flat on your back, the natural inward curve of the lumbar spine, called lordosis, tends to flatten against the mattress. This places prolonged pressure on the lumbar discs, facet joints, and surrounding muscles. For older adults with thinning discs, arthritis, or a history of lower back pain, this flattening can lead to morning stiffness, aching, or even sciatica-like symptoms that linger through the day. Research from the North American Spine Society and studies in the journal Spine have shown that unsupported back sleeping increases lumbar pressure by up to 40% compared to back sleeping with proper knee elevation. The second concern is breathing and airway position. In a completely flat position, the tongue and soft tissues at the back of the throat can fall backward more easily due to gravity, partially blocking the airway. This is especially true for those with mild to moderate obstructive sleep apnea, a condition that affects nearly 50% of adults over 65. The result can be increased snoring, more frequent breathing pauses, fragmented sleep, and lower oxygen levels overnight. Over time, this contributes to daytime fatigue, higher blood pressure, and greater strain on the heart. I've had many patients, particularly men in their 70s and 80s, who assumed back sleeping was the correct way, only to discover that their loud snoring and restless nights improved dramatically once we added simple support. One gentleman told me that after years of his wife complaining about his snoring, a small change in pillow placement brought peace to their bedroom and better rest for both of them. The encouraging part is that back sleeping doesn't have to be abandoned entirely. In fact, with the right adjustments, which we'll cover in detail in the Better Position section, it can become one of the most spine-friendly options. If you currently sleep flat on your back and notice lower back soreness or your partner mentions loud snoring, this may be worth addressing gently. As we wrap up the positions to avoid, we'll move to the fourth and final one, sleeping on the right side as the primary position. We'll discuss why the left side is generally preferred for heart and digestive health, and how consistently favoring the right side can affect circulation and acid reflux in older adults. We've now covered 3 positions that can quietly contribute to discomfort and poorer sleep quality in older adults. Let's complete the list with the 4th, consistently sleeping primarily on your right side. Please understand, side sleeping in general is actually one of the healthiest options for most seniors, and we'll soon explore why. However, when the right side becomes the dominant or only side used night after night, it can create a few specific challenges that tend to become more noticeable with age. The main reason has to do with the way our internal organs are arranged. The heart sits slightly to the left of center in the chest, and the stomach and a large portion of the liver are also positioned more on the left. When you sleep on your right side, gravity pulls these organs downward across the midline of the body. This can place mild but sustained compression on the heart and increase pressure in the stomach. For the heart, research published in the Journal of the American College of Cardiology and studies from the Cleveland Clinic have shown that right-side sleeping can slightly reduce cardiac efficiency during sleep compared to left-side sleeping. In older adults with any degree of heart enlargement, mild congestive issues, or reduced pumping function, this added gravitational stress may contribute to subtle fluid shifts, more nighttime awakenings, or a feeling of heaviness in the morning. For digestion, right-side sleeping tends to encourage acid reflux. The esophagus enters the stomach on the right side, so when you lie on your right, stomach acid can more easily flow back upward into the esophagus, especially if dinner was eaten within 3 hours of bedtime. Studies in the American Journal of Gastroenterology have found that right-side sleeping increases reflux episodes by up to 30% compared to left-side sleeping in people with GERD or occasional heartburn, which becomes more common after age 65. Finally, the lower shoulder and hip on the right side bear prolonged weight. Over months and years, this can lead to bursitis in the shoulder, hip soreness, or numbness in the arm, issues I frequently see in patients who have favored one side exclusively. One patient in her late 60s came to me with persistent nighttime heartburn and occasional palpitations. She had slept on her right side for decades because it felt comfortable. When we gently encouraged alternating sides, with a preference for the left, her reflux episodes decreased dramatically within a week, and she reported sleeping more soundly. Again, the message is not to avoid side sleeping altogether. In fact, as we'll see shortly, left side sleeping is one of the very best positions for most older adults. The key is balance and awareness. If you currently favor the right side almost exclusively, consider gradually introducing some time on the left, especially during the first part of the night when digestion is most active. With that, we've now covered the 4 sleep positions that research and clinical experience show are generally the least supportive for seniors: stomach sleeping, tight fetal position, flat back sleeping without support, and primarily right side sleeping. In the next section, we'll turn to the encouraging part, the 4 much better positions you can start trying tonight, complete with simple, practical tips and pillow placements that make the transition easy and comfortable. I'm excited to share these with you because they truly help so many of my patients wake up feeling refreshed and ready for their day. Now that we've carefully examined the 4 positions that can quietly contribute to discomfort, stiffness, and poorer sleep quality in older adults, it's time for the part one always look forward to most, sharing the 4 much better alternatives that research and years of clinical experience show are generally the most supportive and restorative for seniors. These positions promote neutral spine alignment, easier breathing, better circulation, and reduced pressure on joints, helping you wake up feeling looser, more rested, and ready for your day. The beautiful thing is that they require no expensive equipment, just mindful pillow placement and a little patience as your body adjusts. Let's begin with the position that many experts, including cardiologists and gastroenterologists, consider the single best choice for most older adults: sleeping on your left side with proper support. Left side sleeping, sometimes called the left lateral decubitus position in medical terms, offers several unique advantages that become especially valuable as we age. First, heart health and circulation. When you lie on your left side, the heart remains slightly elevated relative to the rest of the body. Gravity assists venous return from the lower body toward the heart, reducing the workload on the heart overnight. Studies published in the Journal of the American College of Cardiology and research from the Cleveland Clinic have shown that left-side sleeping improves cardiac output during sleep compared to right-side or supine positions. For older adults with mild heart enlargement, early congestive symptoms, or simply wanting to support long-term cardiovascular health, this subtle advantage adds up over years. Second, digestion and acid reflux prevention. The stomach's natural anatomical curve places the esophagus entry higher when lying on the left side, making it much harder for stomach acid to flow upward. Multiple studies in the American Journal of Gastroenterology, including a large review of over 1,000 patients with GERD, found that left-side sleeping reduced reflux episodes by 50 to 60% compared to right-side sleeping. Many of my patients who used to wake with heartburn or a sour taste in the mouth report near complete relief after making left-side sleeping their primary position. Third, breathing and sleep apnea. Left-side sleeping keeps the airway more open by allowing the tongue and soft palate to fall slightly forward rather than backward. This reduces snoring and breathing pauses in many people with mild to moderate obstructive sleep apnea. To make left-side sleeping truly supportive and comfortable, here are 3 simple guidelines I share with every patient. 1. Use a pillow between your knees. This keeps the top leg from sliding forward and twisting the lower back or hips. A standard bed pillow folded in half or a dedicated knee pillow works perfectly. 2. Hug a pillow or place one in front of your chest. This prevents your top shoulder from rolling inward and maintains better spinal alignment. 3. Choose a head pillow that keeps your neck in neutral alignment. Your ear should line up with your shoulder, neither too high nor too low. I've seen remarkable changes with this position alone. One patient in his mid-70s had struggled with nighttime palpitations and reflux for years. After consistently adopting supported left-side sleeping, he reported deeper sleep, fewer awakenings, and a noticeable improvement in his morning energy within 2 weeks. If you currently favor the right side or another position, don't worry, transitioning is gentle. Start by setting up your bed with the supportive pillows on the left side and begin your night there. Even spending the first few hours on the left can provide significant digestive and cardiac benefits. We'll now move to the second better position, back sleeping with proper elevation and support, an excellent choice for those who prefer sleeping on their back but want to avoid the pitfalls we discussed earlier. I'll show you exactly how to add simple pillows to protect your lower back and keep your airway open. Building on the benefits of left side sleeping, let's explore the second position that offers excellent support for many older adults, back sleeping with proper elevation and support, often called the elevated supine position. This is particularly helpful for those who naturally prefer sleeping on their back or find side sleeping challenging at first. When done correctly, it maintains the spine's natural curves, reduces pressure on joints, and promotes easier breathing, all while being gentle on the body overnight. The key advantages of supported back sleeping are rooted in alignment and elevation. First, spinal health. By placing a pillow or rolled towel under your knees, you restore the natural lordotic curve in your lower back, preventing the flattening we discussed earlier. This reduces pressure on the lumbar discs and facet joints by up to 40%, according to research from the American Chiropractic Association and studies in the journal Ergonomics. For seniors with arthritis, sciatica, or general lower back sensitivity, this simple elevation means waking up with far less stiffness and more ease of movement. Second, breathing and acid reflux. Elevating the head slightly, with a wedge pillow or stacked pillows under the upper back and head, keeps the airway more open and prevents stomach acid from rising. The National Institutes of Health and Studies in Chest Journal have shown that a 10 to 15 degree elevation reduces sleep apnea events by 25 to 30% and cuts reflux symptoms in half for those prone to heartburn. Many patients tell me this change alone transforms their nights from interrupted and uncomfortable to deep and restorative. Third, overall circulation and comfort. The supported position distributes weight evenly across the back, minimizing hot spots on hips and shoulders. It's also ideal for those with shoulder impingement or rotator cuff issues, as the arms can rest naturally at the sides without rolling inward. Here's how to set it up tonight. It's straightforward and uses items you likely have. 1. Start with your mattress. If it's very firm, add a thin topper for cushioning. Lie on your back. 2. Place a pillow under your knees, just high enough to feel a gentle lift in your lower back, about 4 to 6 inches. This supports the lumbar curve without over-elevating. 3. For the head, use a cervical pillow or fold a towel into a small roll under your neck to cradle the natural curve. Your head should stay level with your spine, not tilted forward or back. 4. If reflux is an issue, elevate the head of your bed slightly or use a wedge pillow for the upper body. I recommend practicing this for 10 to 15 minutes before bed to get comfortable. One of my patients, a retired teacher in her 80s, had avoided back sleeping for years due to chronic lower back pain. After incorporating knee support and a gentle head elevation, she now sleeps through the night and starts her mornings with yoga, something she hadn't done in a decade. If you have severe sleep apnea, consult your doctor about CPAP compatibility, but this position often complements it beautifully. With supported back sleeping in your toolkit, you're well on your way to better nights. Next, we'll cover the third better position, side sleeping with a pillow between the knees, a fantastic option for spinal alignment and joint relief. I'll demonstrate exactly how to align your hips and spine for maximum comfort. Our third better sleep position is a wonderful option for almost every older adult, especially those with hip, lower back, or knee discomfort, side sleeping with a supportive pillow placed firmly between the knees. This simple addition transforms ordinary side sleeping into one of the most spine-friendly and joint-protective positions available. Whether you choose left side or right side, the knee pillow makes a remarkable difference. The primary benefit is spinal and pelvic alignment. When we sleep on our side without support, the top leg tends to slide forward and downward due to gravity. This twists the pelvis and lower back, placing uneven pressure on the lumbar spine, sacroiliac joints, and hips. Over hours each night, this misalignment contributes to morning lower back pain, hip tightness, and even sciatica symptoms in sensitive individuals. By placing a pillow between the knees, you keep the top leg parallel to the bottom one, maintaining neutral pelvic alignment. Studies from the Journal of Orthopedic and Sports Physical Therapy and the American Physical Therapy Association have demonstrated that this small intervention reduces lumbar and hip torque by 30 to 40%, significantly decreasing pain and stiffness upon waking. Additional advantages include reduced pressure on the hips and knees themselves. For seniors with arthritis, bursitis, or previous joint replacements, the pillow acts as a gentle cushion that prevents bone-on-bone contact and eases inflammation overnight. Many patients with hip osteoarthritis tell me this is the single change that finally allows them to sleep through the night without pain waking them. Shoulder comfort is improved as well. With the hips properly aligned, the upper body stays straighter, reducing strain on the top shoulder. Here's the easy setup I recommend. 1. Choose a firm pillow. A standard bed pillow works well, or a dedicated contoured knee pillow if you prefer. 2. Lie on your side in your usual position. 3. Place the pillow between your knees so that your thighs are parallel and your ankles are slightly apart. The pillow should be thick enough to keep your top hip directly above the bottom one. 4. Extra comfort. Hug a second pillow in front to support your top arm and prevent forward shoulder rolling. I encourage starting with this position even if you've never used a knee pillow before. One patient in her mid-70s had suffered chronic hip and lower back pain for years. After just 1 week of consistent knee pillow use, she reported waking up with dramatically less stiffness and greater ease getting out of bed. This position pairs beautifully with left side preference for added heart and digestive benefits, but works effectively on either side. We have one final better position to cover, the relaxed semi-fetal position, which combines comfort and support for those who enjoy a gentle curl. I'll show you how to achieve it without the tight compression we discussed earlier. Our fourth and final better sleep position is one that offers comfort and security while avoiding the tight compression we discussed earlier, the relaxed semi-fetal position. This is perfect for those who enjoy a gentle curl but want to protect breathing, spinal alignment, and joint health. Instead of drawing knees high and rounding the back sharply, you maintain a softer bend, knees at about a 45-degree angle, back gently curved but chest open. The benefits are wonderful. The slight flexion supports the lower back's natural curve without flattening it, while the open chest allows fuller diaphragmatic breathing. Research from the Sleep Research Society shows this relaxed posture increases deep sleep stages and reduces nighttime awakenings compared to tight fetal curling. It also eases pressure on hips and knees, making it ideal for arthritis or general stiffness. To achieve it comfortably, 1. Lie on your side, preferably left for added benefits. 2. Place a pillow between your knees for alignment. 3. Draw your knees forward gently, not up to your chest, but just enough to feel supported. 4. Hug a pillow lightly or rest your top arm on your side to keep shoulders open. Many patients describe this as feeling cozy yet free, secure without restriction. With these 4 better positions, left side with support, supported back sleeping, side sleeping with knee pillow, and relaxed semi-fetal, you now have practical, evidence-based options to choose from or rotate through. Start with the one that feels most natural tonight, and give your body a week or 2 to adjust. The improvements in morning comfort, energy, and overall well-being are often noticeable and lasting. Before we close, I want to thank you sincerely for spending this time with me. My deepest hope is that even one small change helps you wake up feeling more rested, less stiff, and more ready to enjoy your days. If this video has been helpful, please take a moment right now to give it a like, subscribe with the bell turned on, and share this video with your friends, family members, or anyone you know who struggles with sleep or morning pain. Your share could truly improve someone else's quality of life. I've prepared a completely free guide summarizing all 8 positions, the 4 to avoid and the 4 better ones, with clear diagrams, pillow recommendations, and a quick checklist. The link is in the description below and pinned in the comments. Download it tonight and keep it by your bedside. And please, in the comments, share which position you're going to try first or which city or state you're watching from. I read every one and love hearing from you. Remember, small adjustments in how we sleep can bring meaningful relief and joy to our days. Thank you for trusting me with your time. Take good care, sleep well, and I'll see you in the next video. This is Dr. Choi Smith. Good night.